When a person is constipated, sometimes as they can have fissures. The other thing that happens because of constipation is formation of piles. Now, what are piles? They are that whole area has a lot of blood supply, and those blood vessels, if they dilate and start projecting into the anal canal, that is called piles. Piles are of different types. They can be internal or they can be external. So by internal piles, I mean that they will be the first stage, that the blood vessels have dilated and they start bulging into the anal canal, but they are completely inside the body. When this increases in size some more, then they can start coming out of the anal canal. That is called an external. So when this external pile, sometimes what happens is the blood clots inside it. And if this happens, then the external piles becomes a thrombosed pile. So these are the three main types of piles that we need to remember. It starts with an internal pile. The second stage would be that internal pile coming out while the patient passes motions and going back in once they tighten up the sphincter. The third stage is when it comes out, but it is so big now that it doesn't go in at all. So it remains outside. So these are three, in fact, stages of the piles formation, indicating the severity of the condition. And sometimes when the blood vessel in that piles get clotted, then it can lead to what is called a thrombosed pile, which is usually very painful. Constipation, straining at stools, then pregnancy itself, because during pregnancy, the woman has a baby inside for 9 months, and the pressure of that baby is on the anal canal. So that can also give rise to piles. Similarly, if there is a tumor inside which is pressing on the anal canal, it can again give rise to piles. These are the most common causes of piles occurring. When there are internal piles, the first sign that the patient will come with is bright red bleeding while passing stools. And the difference between bleeding due to piles and bleeding can happen with anal fissures also. So the difference between these two is that the bleeding from piles is painless, whereas bleeding associated with anal fissure is very painful. This is the first sign that the patient can come with. When the stage increases, it moves on to the second stage. Again, the patient will say that there is some bleeding and something comes out while I'm passing motions, and then it goes back in. In the third stage, when it becomes an external pile, then the patient will come with the symptom that, of course, there can be bleeding, and along with that, there will be some mass which is remaining outside the anal canal at all times. These are the symptoms that the patient comes with. In case blood clots in the piles, then they will also have very severe pain associated with it, because there is that swelling which has become hard now. So that is the only time when piles become painful. And this is the most common symptom of a pile. The bleeding itself, the mass coming out of the anal canal, and the sometimes the hard painful mass that is there. The way it is diagnosed is by an examination called anoscopy. That there is a local examination, of course, clinical examination, and then there is a small instrument which can be inserted into the anal canal, and a part of it is removed and the anal canal is visualized. It is like endoscopy of the anal canal. It's just a small tube which can be inserted very painlessly into the anal canal, and a torch shone through it, and it can be seen whether there are some swellings in the anal canal. Piles can be treated First of all, by preventing constipation. So, if it is in an early stage and the patient is given the correct advice, how to modify their diet, what other supplements they can take temporarily, of course. We do not advise supplements or stool softeners on a long term basis, but to overcome the initial acute period, they can take stool softeners. But mainly, it is a dietary advice to drink a lot of water, have a high fiber diet, meaning a lot of fruits and vegetables, so that they're not constipated and this piles doesn't keep on increasing in size. Once it has gone to the third stage, where there are masses coming out of the anal canal and remaining out, then surgery is the correct method of treating it. If it is inside, there are some other treatment methods which are called rubber band ligation. So the bunch of blood vessels is visualized through the anoscope and caught, and a rubber band, small rubber band is applied to it, so that those bunch of piles are taken care of. Sometimes some doctors may prefer to give a sclerosing injection. So they inject into that pile mass, and that pile mass becomes hard and falls off. That the blood vessels are clotted because of the sclerosing injection and it just falls off. And the third modality of treatment, as I said, when the piles have become very big and are outside the body, they're called external piles, then they will need surgical treatment. If there is a lot of bleeding from the piles, it can lead to very severe anemia. I have seen patients who have been walking, moving around, but they have a very low hemoglobin level, which is as low as 5 milligram percent or even lower than that, because they've been slowly losing blood from those piles. That is one very important complication. The second complication, as I mentioned, is that those vessels may get clotted and become very painful. Also, when they become clotted, they become the site for, it's the preferred site for bacteria to lodge in. So it can very easily get infected, leading to abscesses, pus formation there. And if pus formation occurs in such a place, there is always a risk of what is called a fistula. So these are the more common complications associated with piles. Very rarely there can be loss of bowel control because of surgery for a piles. That is hardly ever there. If it is done properly, there won't be any loss of bowel control. The loss of bowel control is more commonly seen after surgeries for a condition called fistula in anal, where the fistula may come out. The fistula is a passage from the anal canal to the exterior, that is the skin. And if it is going beyond the anal sphincter, and that sphincter has to be cut to treat the fistula, then it can lead to loss of bowel control, generally not after a pile surgery. The best home remedy for piles is to eat a very high fiber diet, drink a lot of water, and see to it that stools don't get hard. So a normal bowel habit is the clue to avoiding conditions like piles, anal fissures, fistula and ano, keeping a proper hygiene of that place. And the proper hygiene is mainly maintained by having soft stool and a regular bowel habit. Piles can be prevented by preventing constipation. If that doesn't happen, most of the cases of piles do not happen, except for some conditions, as I said, because of pregnancy, and that is something that is the order of nature. So, if some woman unfortunately lands up with piles post pregnancy, many of these piles that are there during pregnancy get corrected automatically on their own. If they don't get corrected, then depending on the degree of the piles, whether it is first degree within the anal canal or third degree outside the anal canal, they may need surgery for it. So that the posture of squatting is set to help proper anal canal pressure, the proper angle gets maintained, and piles can be avoided because of that, because it gives the correct pressure to be exerted. So that is said, it is said that the Indian method of squatting to pass motions is a better way of doing it.